Welcome to the Daily Dose. This is a podcast that focuses on really giving you all the information you ever want or need about med spas, injectables, aesthetics, plastic surgery, and even more. So today, we wanted to make our first episode actually about the med spa and the people in the med spa and understanding how that med spa works and understanding the people inside and how they got there and if they should even be there.
Exactly.
Yeah, but I guess before we do that, we can talk a little bit about who we are.
Yeah, we can do that.
Yeah, so my name's Dr. Kocak. I go by Dr. K. I'm the medical director to Dose Med Spa. I'm a board certified. That's certified by the American Board of Plastic Surgery. And by the end of today's episode, I hope everybody knows what that means. I'm a board certified plastic surgeon. I practice my practice is Midwest Breast and Aesthetic Surgery. And our practice has offices from Columbus up to Bluffton and all the way into Toledo. My practice is primarily in the Northwest Ohio area in Bluffton and Toledo. And I have the distinct honor and pleasure of being the medical director of Dose Aesthetics. And Dose Aesthetics is the med spa that was born and created by this lovely lady here, Samantha Champion.
Yeah. So I'm Samantha Champion. I am a board certified nurse practitioner and family medicine. And I'm also CAN certified, so certified aesthetic nurse specialist. We practice in Bowling Green, Ohio and Maumee, Ohio.
And we together have an incredibly amazing practice full of amazing people. We have other injectors, Julie David. We have other ones joining us soon. We have an amazing esthetician,
Lindsay.
Yeah, Lindsay is the person who gets everybody all shiny and perfect on the skin side.
Yep.
And then we have an incredible staff that keeps everything running every minute of every day.
Oh yeah.
You guys can't see them right now, but in the corner of this room right now, we've got Jordan and Annabelle. And they're laughing and giggling and giving us all kinds of, silly faces. But that's okay. Soon we'll turn the cameras on them, and it'll be fantastic.
They'll have their episode.
Oh, yeah. And I mean, if we want to...
Bianca and Gracie.
Yeah, but and Bianca and Gracie, yeah. And you'll meet them hopefully soon, too. But I think just as a little spoiler, I think we can let everyone know that our episodes are going to cover all kinds of stuff, right? We're going to cover the things that happen in the med spa, the types of services that we provide. Our goal is to make sure that we can give information to anyone who's already getting or thinking about getting services in a med spa environment. Or we'd like to kind of go beyond that and talk about plastic surgery, cosmetic surgery type procedures, and how sort of the med spa and surgical worlds sort of work together.
Yes.
And then I think we'd really like to also venture into some episodes that cover some even more interesting things and maybe sometimes even some fun stuff. Maybe even we'll have an ASMR episode. We'll see.
I can't wait for that.
Yeah, I think we will. But anyways, let's dive right into it. So now you know who we are. Today's goal really is to kind of talk about when a person goes to a med spa or even a practice, a plastic surgery, or even a medical practice for that matter, how does someone know really who's treating them? And I think that's a lot harder to answer than I think most people think.
It's tough.
Yeah.
I mean, I think we have several patients that I can think of that they'll come in and they'll tell us, I did my research. But sometimes they don't know where to necessarily.
So like when people come in, you obviously get this from all kinds of people, and I don't get it as much as you. So maybe you can tell me, like, what kind of things do they say that they found as credible sources, or what led them to think that a place was good or bad?
So one that I notice it seems to be like the most common one is they'll say that their plastic surgeon is double board certified.
Whoa.
Double board certified seems to be...
What if they're triple board certified?
Right? I don't know.
That's a lot of boards.
Intense.
Yeah, so board certification's an interesting one.
Yeah.
What does board certification mean?
Exactly.
Well, at least in medicine, I can talk to that, and then maybe you can kind of talk to it in the nursing world.
Yeah, absolutely.
But ultimately, board certification is a certification that comes from a board. So the most important thing to understand there is probably what board is the certification coming from.
Correct.
And I think one of the trickiest things people encounter online when they're doing their research is that someone might just make a statement that says that they're board certified in my field. The best one is they're a cosmetic surgeon, or they're board certified cosmetic surgeon.
Yes.
So interestingly, if you are looking to find a doctor or a surgeon, it's usually ideal and best to find someone who's certified by a specialty or a field that is actually recognized by the American Board of Medical Specialties. That's the ABMS. If their board certification is not part of a board that is on the list provided by the American Board of Medical Specialties, then chances are they are from a board that has not really undergone the same scrutiny and is not really held to the same standards. And certainly there are boards out there that have their own processes, but they're all kind of made up for their own needs and their own purposes. So my field, I'm a plastic surgeon. I'm a board certified plastic surgeon, which means that I went through a residency, and that residency was many, many years. I actually ended up doing 8 years of residency, and that involved general surgery and plastic surgery.
That's the tricky part. You said plastic surgeon, but so many people see cosmetic surgeon and they automatically put cosmetic with plastics. So when they come in, they say it's a plastic surgeon, and sometimes those practices will mislead them intentionally, clearly, and they just put it together. They just assume that means plastic surgeon.
And for us, it's a real frustrating thing.
Yeah.
I mean, because the tough part in the United States is that anyone with an MD or DO, for that matter, they can actually put a sign on the door and do whatever they want.
Yeah.
And there's really no limitations to the scope of their practice. The only things that actually limit a person's ability to practice is, say, for example, if they're going to do surgery in a hospital, well, then the hospital gets involved and says, oh, for you to do these cases in our facility, you have to show certain credentials. And then you have to show your board certification or whatever.
Which is so important, because what people fail to realize, I think, is that if they have something done in office and that person's a cosmetic surgeon, which hospital are they going to go to in the event of an emergency?
So if you're taking notes, which I hope you are, sharpen up your pencil right now. And your first thing you're going to write down is that. So if you're looking for a list of things that you're going to use to vet your surgeon or med spa or injector or provider, I think the first thing is that if you're talking to a surgeon, if you're talking to a cosmetic or plastic surgeon, first thing you're going to want to ask is a matter of safety. You're going to ask, okay, if you're going to do this procedure to me in your office, what happens if I have a complication that requires hospitalization, or if I need to go to a hospital to have surgery in a hospital? At which hospitals are you credentialed to perform surgery? I'll say it one more time. At which hospitals are you credentialed to perform surgery? I think, honestly, that is probably one of the most important questions.
It really is.
A person can ask.
It is. And I think sometimes in the med spa world, I think when they see you and they see you at the hospital and they're assigning stuff, they get a little bit more nervous. They have the hospital gown on. It seems more medical. Mm-hmm. But in our world, it seems cute. It seems fun. And those are the words that people use when they describe and I love it because I think it's cute and fun in a lot of things. And a lot of people, even when they want to come here to work, they say it looks like fun. And that's super cute. But it is still serious, and it's still medical. And in the event of an emergency, we have to know what to do.
Yeah. And so I think that, as we kind of talk about this, I've got my notes and stuff open here, but I think that really is, if you could reduce it to one, I would say the most important question a person can ask, at least their surgeon. Now, if you're in the med spa.
It's different.
Yeah.
It's different because I'm not a board certified plastic surgeon, and so many people can do this, and they're great at it. It doesn't take away their eye or their ability to create something, but it's not a matter of if, it's a matter of when something happens. And do those people know what to do? Or do they have the appropriate lifelines to call if something were to happen? And I think that's important.
So what's your lifeline?
You.
Oh. Well, How flattering. But that's a good point, because so it goes back again to this question of, if there's a problem that goes beyond the scope of what can be done in an office, what's going to happen to you, the patient? I mean, are you going to get taken somewhere? So in this setting, I'm a plastic surgeon and I'm the medical director. And if there's an issue that will end up in my hands, ultimately, if there's something that goes to the point of, requiring medical attention in a hospital setting, I happen to be credentialed at, I think at the very moment, I'm probably credentialed at over, it's at least 5 or 6 hospitals across Ohio. And you have to realize each and every one of those places, every time we apply for credentials, I mean, it's a process. Boy, do they go through our stuff. It's a serious process. Yeah, they want to make sure that not only am I certified by the American Board of Plastic Surgery, which is recognized by the American Board of Medical Specialties. That's another thing to write down, by the way. Sharpen the pencil, American Board of Medical Specialties. But not only do they go into that, but they ask for case logs, where I have to give them case logs that can actually be verified. Not just me saying, "Oh yeah, I've done 1,000." No, I have to actually prove that I've done these cases. And they go into several other things. They look at our past. They try to see if there's been any flags or any issues in the past. They dig into our NPI numbers, which anyone watching this or listening to this can do. You can just go to a website for the National Provider Identification, the NPI, and you can pull up a physician, and you can see if there's been any issues. And you can then go to the state medical boards. And every state has a medical board. And to practice medicine or anything in a state, we have to have licensure in that state. I'm in the state medical board. You also have a board.
Yes. Board of Nursing.
Board of Nursing. And so it's the same thing. And someone can look in there and check and verify your credentials.
Same exact thing.
So another great thing to do anytime you're about to sit in a chair and get injected or have procedures done by someone who is a nurse or nurse practitioner, maybe before you do it, sit down and pull up those websites, punch in that person's information, and make sure that they have a current, valid license to practice what they're practicing in that given state.
Absolutely.
I think that brings up another kind of interesting thing, though, is like, for me, it's pretty easy, right?
Yeah.
If a patient's going to look up their surgeon, I mean, I say it's pretty easy, but still people still get really confused about what's a cosmetic surgeon, what's a plastic surgeon. I think we've kind of covered that, but we'll beat it into the ground, because if I'm going to get one thing across today, it's going to be that one thing. But also, I think for you, in sort of on the injector side, tell them what you did. I mean, it's just important to see, because if a person walks in and I'm a patient and I come to you and say, it's very easy to say, well, have you done this before? Sure. I mean, there's no way to verify if that answer is valid or not valid.
That's true.
And I also think if you ask someone how many of something they've done,
that's true.
I think that it's pretty, I think it's pretty well understood that most people will overestimate their experience.
So for us, again, I think going back to like me saying, there are doctors that do this and they inject and they're wonderful. But as a nurse, what can you look for? Where are those like extra little credentials or
so how does a patient know that the person, the nurse or nurse practitioner who's about to inject them or perform, other procedures on them, how do they know if that person has traveled a path that should give them the experience needed to do a good job? I mean, again, you're not going to know for sure, but at least let's create some objective criteria. So let's kind of go through your path, because there are no objective steps in this. You kind of, it's more of like apprenticeships and kind of like traveling the right path. But for you, what did you do? Tell them sort of how you started.
For what I did, and also Julie, so the both of us, we both have worked under a plastic surgeon our entire career.
But in that setting, were you working just as an injector, or were you also kind of as a nurse? As
a nurse as well.
Yeah.
We being in the OR to being and I think that's important. And I think that, we have great competitors here, but they are also board certified plastic surgeons, and you have to give them that credit. And to learn underneath that is great. I do think it's important. But then on top of that, we went and took a certification, the CANS. So it's a certified aesthetic nurse specialist. Why does that matter?
Certified aesthetic nurse specialist.
Yes. It's just that extra step. And I'm not saying that there are not injectors out there that have not completed that and that they are good injectors and they've been doing it for years. But for us, we just wanted to take that extra step. And you can only take that test if you are practicing underneath a plastic surgeon, a dermatologist, or facial plastics.
Wow.
So they have criteria in there for what type of surgeon or physician can write off on you to be able to sit for the exam. You also have to complete so many hours, and it has to be within that specialty. Mm-hmm. So those things matter because these med spas are popping up left and right on every corner, and people are stating that they're training and they've not even injected a face. I mean, that to me is outrageous.
So this cans, I'm just kind of, since I'm the fact checker, I'm the fact checker, right? That's what I do. This CANS is the Certified Aesthetic Nurse Specialist credentialing. And so this CANS thing is under the International Society of Plastic and Aesthetic Nurses, right? And so I'm like kind of looking this up and trying to understand it. This CANS certification, it's part of a larger organization. So CANS is just a certification. It's offered by the International Society of Plastic and Aesthetic Nurses.
Correct.
And that is actually pretty significant. I mean, that's a society where nurses can become members. Mm-hmm. And again, it sounds like there's a vetting process for that. And it's people who are nurse yes. practitioners, and their practices focus on aesthetics.
Correct.
Yeah. And it looks like very much that they have a pretty high standard and they offer tons of educational content.
Yes.
So are you part of that as well then?
So I am part of that. And so is Julie.
Got it.
Which I think is important, in my opinion.
So again, the person, the patient out there looking for a place to go, first thing they can check on if they're going to be meeting with a nurse or a nurse practitioner. And again, remember, every state's a little different. I think every state has a different level of regulations on who and who cannot do these types of procedures.
But CANS is offered everywhere in every state.
Right, yeah. But like in your given state, I think if your state allows for people who are anything other than a nurse practitioner, or a physician, that's a tough one. I don't even know. Are there states out there like that?
What do you mean?
I guess PAs can inject out there too.
There are some PAs that can inject. Absolutely, yeah.
But anyways, but the first thing a person can look at and make sure their provider is at least part of this ISPAN and one step further if they're CANS certified.
And I think there's only, don't quote me on it, but around like 800 in that.
CANS?
Yeah, check.
Oh, I'm not going to just quote you on
Okay,
that.
Please do.
I'm actually going to fact check. I'm fixing to fact check.
I think at one point it was 755. So we'll say maybe 800.
That's a very exact number.
I know. So now fact check me.
Okay. So I'm going to go to the most authoritative source that I'm aware of.
ChatGPT, of course.
ChatGPT. We are not sponsored by ChatGPT, but however, ChatGPT, if you would like to sponsor us, we are very open and willing to have the discussion.
Love it.
Because we will consult ChatGPT regularly on our podcast. Hi, ChatGPT. So how many CANS certified nurses are there in the US of A? All right, let's see. Here it comes. Drum roll. That wasn't really a good drum roll.
Watch it be like 10,000.
There are 14,000. Just kidding. No. It turns out, actually, that it's even more exclusive than you thought. The latest available data, there are 576 certified aesthetic nurse specialists actively certified in the United States.
Yeah.
And it's because it's a pain in the ass.
Yeah.
I watched you do it.
Yeah.
I had to go sit through the course with you. It was brutal. Yeah. I learned a lot, but it was brutal. So what else can a person look for other than simple, generic questions like, oh, have you done this long? And, oh, do you have some before and afters that you probably doctored and photoshopped?
Oh, yeah. We can talk about Photoshop. Is that a whole different episode?
Why? Is there a lot to talk about?
I feel like there is.
Oh, man. Because we sit there. So All right, just so everybody knows, I mean, not that it's not already obvious because I'm staring at her like I'm going crazy. Samantha and I are obviously in love. She's my favorite person in the world. We'll be together forever, and we have the most beautiful baby in the world together, and we have 4 other beautiful children. But we sit around in bed at night, and our favorite hobby is to go through before and afters and try to figure out which ones are Photoshopped.
Yeah, it's really fun.
It's a fun thing. So let's talk about Photoshop.
Okay.
I mean, that's a fun topic.
Well, first, did we hit all the topics? Because I feel like I want to really...
Oh, we'll wander back.
Okay.
Oh, we'll wander back. I mean, just kind of drop it out there so we know what we should come back to.
I mean, there's literature, right? I mean, you're our guy who knows all the studies and the research. You like to message Julie and I and say, read this article.
I'm a nerd.
Julie and Dr. Kocak are. I'm not as much of a nerd.
Yeah, she says this. She says this. But then I'll look. I will. I'm not joking. I'll wake up some nights. It's like 1 a.m. I'll open my eyes and I'll look over and she's on her phone or on her computer and she's like sitting there going through like instructional courses.
True.
Looking up stuff about like the products and stuff that are coming out in the space. I mean, come on.
Yeah, no, I know.
Don't
I do.
even.
I do.
I'm going to call your bluff right now.
Go ahead.
Anyways, so Photoshop.
Photoshop. So
We like to use it frequently?
yeah.
No.
No, not us. Not us. But lots of practices do. There's lots of tricks. And I'm not saying
All right, so how's a patient who's sitting there on someone's, what's the right way to say it? IG? The gram. On the gram.
The gram.
They're on someone's gram. And they're sitting there and they're flipping through their before and after. So what is a person looking for if they're trying to really know that they're looking at real stuff or not?
It's tough because I think things are getting harder to tell whether or not they are actually Photoshopped, to be honest.
Well, even
it's
before
really hard.
Photoshop, I mean, there's the age-old plastic surgery tricks, right, for photos.
You've taught me those.
Yeah, I mean, just the flash can do amazing things,
right? The flash can do
Yeah.
amazing things.
So if you see it before that doesn't have a lot of light on it, and then the after, suddenly it's like they found the sun and a light and a flash. Well, a flash does brilliant things to kind of wipe out the shadows because shadows are caused by creases and wrinkles. And so a really good flash is even better than Photoshop sometimes. You can just poof, knock out everything.
Yeah.
So look for that. That's an easy thing to look for when you're...
That's an easy one.
Angles, makeup.
Angles, makeup.
Smiles, no smiles.
Yes.
Yeah. Oh, miles. Just kidding. Smiles, no smiles. And so that's like, those are the things that we were kind of taught to like look for. But
They
now,
are, but it's different now because the world of IG is not always...
That stands for Instagram, by the way.
It's not always trying to capture the immediate before and after on some of the pages, which is okay. I can see where they're like, hey, look at her glow up. Hey, look at where she's come this far along in the years that she's been with me. And also, patients don't necessarily always come to their follow-up appointments. So you're getting a patient who has had immediate results. And I think some people do specify, like, this was immediate. This is,
Yeah, so knowing
6 months
how
out.
long after the treatment that picture was taken is very helpful.
Yes.
Yeah.
But that being said, the ones that try to portray it as such, I think, is the tricky part because there's great injectors out there who they're like, yes, my patient has makeup on in this photo, but look at her. She looks amazing. And the quality of her skin, and she comes in that office and she's really happy. So, I mean, I think sometimes we want to capture that too. And I think some people use that platform in a way to really just try to connect with their people. So I don't always knock it. So I think we even do that sometimes.
Oh,
but
absolutely.
when you're trying to portray it as such, when you're trying to say, hey, this is look at my before and after, it's amazing after one, and I can, guarantee like this type of a result for everyone who walks through my door. Those are the red flags.
Yeah.
Back to plastic surgeons being board certified. I'm going to bring it back to your stuff, why that matters, because I've kind of explained it for our stuff and injectables and the things that you can look for. But I think your world's a little different. It's not the same as injectables.
Yeah, I mean, it's only different in the sense that we have a bit more of, there are pretty objective clear pathways to get to a particular place. Like to be a plastic surgeon, there's only one path to be a plastic surgeon. Like you have to go through a plastic surgery residency, which takes about 6 years, 5 or 6 years, depending on when someone did it. There are also combined programs that can take a little longer. It just depends on the path. But again, these are accredited residency programs. If you want more words, these are residency programs that are accredited by the ACGME. And let's see if I can come up with that. The American something of Graduate Medical Education. I can't remember, but it's ACGME.
Close enough.
So the ACGME would be accrediting the residencies. And if a residency is official, it would be accredited by the ACGME. And there's a plastic surgery residency. One would go through that and finish the training. And then after residency, the surgeon would then sometimes take a fellowship training to super specialize. I did microsurgery, which isn't recognized by any board or anything like that. It was just a year of my time so that I could master a subset of my field, which is putting together super duper duper tiny vessels to be able to move tissue from all parts of the body to another part of the body. And then after that, one has to become certified by the American Board of Plastic Surgery. So to be certified by the American Board of Plastic Surgery, which I mentioned before, is part of the American Board of Medical Specialties, one has to do a lot. Like the process is actually pretty rough.
How many hours
Yeah.
do you have to have for your
Well, I mean, not just
within your-
hours, but like you can kind of look at cases. I mean, I was kind
how
of
many
looking
cases?
at So we were talking about cosmetic surgeons before, right? So people will tout that they might be something like a family doc or something like that, and they're now sort of advertising that they're a cosmetic surgeon, and so they can do that. They can do that because there's really no other regulatory bodies in this country that prohibit them from doing it. They have an MD or a DO, and they can technically practice whatever they want. So how do they come to be able to practice that? Well, they go through these certification programs. They go through these, smaller, shorter types of programs that have been created mostly by non-plastic surgeons. And so that they can try to do these procedures in the outpatient setting. And again, that goes back to, if you don't have the ability to operate on someone at a hospital, then you probably aren't a plastic surgeon. Because normally a plastic surgeon would be able to get credentials at a hospital to be able, and in fact, to be board certified, we have to have credentials at a hospital where we can admit and operate at. I think our message to everyone sitting here watching us ramble on is that definitely, before you see someone, ask for their specific credentials.
Absolutely.
Very specific. Ask for the program, the name, the institution, and the dates that they occurred. And then you can easily then go online and actually see if those are part of the American Board of Medical Specialties, recognized by ISPAN, whatever. I mean, these are, and then check their credentialing in terms of, definitely check their license in the state. Definitely check their, provider background on the appropriate site, like the state medical board or the state nursing board. Those are all places where people can go and just make sure that the people you're going to see are at least in terms of those basic things, that those are all in place, rather than looking at a bunch of doctored Photoshop pre and post ops.
Absolutely. And that they have a relationship with a plastic surgeon or in those specialties we talked about.
Yeah, like derm and facial plastics. Yeah.
There are plenty of med spas that operate with, they've never even met their medical director. They have no relationship with their medical director. They have
like those medical directors in a box, right?
Yes.
Like it's just kind of like
in
online.
A box.
That's
like
crazy.
Quite literally. And that's
wild.
That's crazy to me. I don't know.
Yeah.
I think it's important because who are they going to then call in the event of an emergency? Because it can happen, or just
who are you going to call?
Honestly, though, there's one. There are sometimes people, instead of calling their medical director, they might be too afraid to or timid to, and
crazy. Yeah, any sort of possible outlet, huh? Yeah, I think that as a patient, as a person looking to go get these services, I think the simplest thing to always remember is, it's all fine when it's fine, but what happens when it's not fine? And I think if as a consumer, I think if you're out there and you actually try to answer that question, rather than how many have you done? I mean, like I said, everyone overestimates. I think it's very easy to overestimate what one's done or what they've done. And there's no way to verify it. It's impossible. You as a consumer cannot verify that thing. And so, like, I think just if you answer that question, what will happen if, like, what is the chain of events if there is an issue? If the issues are always based on specific procedures and what those things might be. Lasers have different issues from injectables, and injectables, they're different ones. Like toxins have different issues from fillers. But I think having a clear idea of what that place and that provider, what plan they have, and what the process is, if they can give you a very clear answer that goes through sort of and ends up with ultimately, if there's a surgical problem, who's doing it? Are they sending you off to an emergency room and you're just then in the hands of someone who was never involved with the process? That's a very difficult place to be. So, and then I think doing a true check on the credentials of a provider or physician, I think is also a very simple thing to do if you know what you're looking for. Absolutely. And I hope at this point, I hope we've given our listeners a pretty clear idea of what those things are. Absolutely. All right. Well, I think it's safe to say that we've communicated the message we wanted to communicate today. We have. And we'll talk about so many other things moving forward. I mean, I know we have a lot of nurses who are eager to learn and they want to know more on what they can do to get into this space. We've had, we put up some stories to interact with people to kind of gauge what our patients and what other people in our profession want to learn. So there's an episode I think we'll do. So you want to be an injector? Yeah. And like we said, there's gonna maybe be an ASMR episode. I think that's can't wait for that one. Because once you get these microphones, it's really hard not to have fun with them. And then we're always open to feedback. I think if you as the listener have something you want us to talk about, we're excited to talk about it. We're here for this. We're here for you. And we're very excited to bring you a daily dose of good stuff every time. Though I don't think it'll be daily. I think it'll hopefully be more like weekly. But it just didn't sound as good to call it the weekly dose. No. Thanks for listening. We really look forward to getting you guys back at the next episode. And please send us any feedback, questions, and any episodes you guys might want us to do. We're really excited to be offering this. And it's so awesome that we get to hang out together and do this because this is basically what we do at home anyways. I know. See you next time. All right.
The content of this podcast is for educational and entertainment purposes only. Although we are licensed medical professionals, nothing discussed in this episode should be taken as medical or legal advice. Always consult with a qualified provider regarding your own health or treatment. We do not accept any liability for decisions made based on the information shared here.